Good evening. Tonight we're going to do OBGYN and OBGYN emergencies. Here we go. First we need to review some important anatomy of the female reproductive system. Let me start by pointing out a few important parts. On each side, no, we'll start in the middle. This part in the middle here is called the uterus. The uterus, okay? It's known in America by lay people as the womb. Same thing. We call it the uterus, all right? And that is right here in the middle. On each side of the uterus are these two shaped things. These are called ovaries. Ovaries. There's one on each side of the uterus. The ovaries are connected each to the uterus with a tube. This is the tube, and it is known as the fallopian tube. So, every female is born with this anatomy. She has a uterus, she has an ovary on each side, left and right, and she has a fallopian tube. What?
Wasn't born a woman.
The idea is that pregnancy should occur in the womb. That is the goal. That pregnancy should occur in the womb. We're going to talk more about this as we move on through tonight. At the very bottom of the womb is a very, very small, tiny opening. This does not depict it well. This looks like it's a huge chasm. All right, it is a tiny, tiny opening. There is almost no space. The only thing that can pass through is fluids, blood from inside, and we'll talk about that in a minute, and sperm from outside can get up into there. So the uterus is very, very closed system, all right? Nothing really can get in and out except for fluids, liquids. So blood can escape through here, through the cervix. Okay, it's also known as the cervical os. All right, and that's important to know. Now the entire uterus has a lining. Okay, similar to the way we had other things with linings and, all right? And the lining of the uterus is known as the endometrium. The endometrium is the lining of the uterus, okay? And what happens is that once a month, the lining will detach itself from the uterus, okay? The lining detaches itself from the uterus. Once a month, an egg leaves the ovary, travels through one of the fallopian tubes into the uterus. There are two options that can happen to this egg. Either it can become an embryo, it can meet up with a sperm and get fertilized, or nothing happens to it, and then the endometrium will fall off, and together with the egg will pass through the cervix, the cervical os, and out through the vagina. This happens once a month, and this is known as menstruation. That's really what you need to know. You don't need to know or worry about all the other stuff that is pointed out. I will get back to this picture a little bit later.
Does it make a difference what side the egg
No,
is?
no.
What determines?
A woman is born with a finite number of these eggs in each ovary. She cannot produce any. She cannot produce more. Whatever she's given, right side, left side, that is what she has
When she's born?
when she's born. Okay, and that's what she has.
So your woman freezing their eggs.
Right.
Okay,
I didn't know what it was.
let's look now.
What's the fallopian?
Fallopian tube. Right? Let's look now at the anatomy cross-section. If we cut down the midline, and we just left with this, and we can figure out what's going on. So, there are, in fact, 3 orifices in the female body, And I think it's important that we understand what is going on and what's going on from each one. Right here at the front is her bladder, and this is where she urinates from. Okay? The middle one is the vagina down here, and there's the what we call the birth canal. And over here is a better representation of the cervical os, which is completely closed. All right? And that leads into this area here, which we said is called the uterus. Behind that is the rectum. All right? And this is where she will defecate from. The reason it's very important to understand this is when you do deliver babies, as I have many, the baby pushes both back and front and comes out through the middle. Therefore, there is a discharge of all types of bodily substances during birth. Okay, it is extremely normal. She will defecate, urinate, there will be blood and birth, water and stuff we'll talk about. That all comes out at the same time. Okay, very important to understand this anatomy. All right. It really makes no difference to you, but now let's go back one slide. As baby is being formed inside the uterus, okay, this embryo will turn into a baby, another organ is grown now. A new organ is grown inside mom, inside the uterus. That organ she is not born with. That only comes when she gets pregnant, and it grows together with the baby. And that is called the placenta. The placenta is attached to the uterine wall by millions of tiny, tiny blood capillaries. And the placenta is the organ that allows for food and nutrients to come from mom into the uterus, and to allow waste to go from the baby back up into mom. All right? So the baby does not actually, the heart and the breathing do not work the same when the baby is in utero as it does once the baby is born. We don't go into all the details of fetal circulation and how that works. We don't do that in EMT school. It's very interesting.
We don't have the umbilical veins and arteries.
Right, you're not going to go into all that.
And the waist, so it's not all, the heart and the brain, the heart and the brain don't work.
Heart and lungs.
Heart and lungs, and as well as all the waste doesn't come out.
Right, no, the waste doesn't come out. The waste goes back up through there, back into the placenta. So the placenta is a new organ. This is where we would like it to be, all right, up here. Now what attaches the placenta to the baby, all right? And that is the umbilical cord. So let's just understand. You have the baby. From the baby's umbilicus is the umbilical cord, hence the name. That attaches directly into the placenta. The placenta is attached to the uterine wall of mom, all right? And then with those many, many millions or whatever of blood vessels attaches to allow blood to come and go, nutrients and waste, all that stuff is going to go through the placenta. So understand the placenta is a very important organ for the development of the child. Stages of labor, this is absolutely nothing you can really do or deal with, but they expect every EMT to know. So I will teach you. All right? So stage 1 begins with when she gets contractions. Okay, you have no idea of knowing when that's going to be. She's going to tell you. I got contractions. Okay. And it ends with cervical dilation. So, what is the purpose of the contractions? Why do pregnant women after 9.5, close to 10 months, have contractions? Okay? Well, no, what the contractions are doing They are dilating the cervix. That is their job. So the cervix will be, like I told you, so tightly closed that all that can pass through is blood out and sperm in. Nothing else. How are you going to get an 8 or 9 or 10 pound plus baby out of a space that only allows fluids in and out? Okay? So it's a good question. And the answer is that's why she gets these contractions. So the contractions will in fact cause cervical dilation. That's what they are doing. That's why she's getting these contractions.
As soon as she begins dilating, why don't all the fluids start coming out?
I'll explain in a minute.
What is the action of the contractions? What is actually happening?
What's
You
causing?
just said.
Not for now. It's causing the...
No, what is happening?
I understand,
Okay.
but we don't have time for that now. We've got to move on. There's a lot to do.
Medics
So it's
will.
causing dilation of the cervical arch. That's what you need to know. All right. So fully dilated is known as 10 centimeters. Okay? Any of you whose wives have been to have a baby, sometimes at the end they will do an internal examination, which you're not allowed to do in the field, and they will tell her, well, you're 2 centimeters dilated, go home, walk it off, take a hot bath, whatever, come back when you're closer to the time. All right? Especially with first pregnancies when she obviously has nothing to gauge it against and really won't know. 10 centimeters is what's called fully dilated, and that's pretty much the distance or the size that it needs to be in order to deliver the baby. So stage 1 begins with her contractions and ends with cervical dilation. Complete cervical dilation. Stage 2, all right, begins with full cervical dilation. Each stage begins with the end of the stage prior, and it ends with the birth of the child. Okay? Stage 3 begins with birth of the child and ends with delivery of the placenta.
Oh, yeah. Didn't you bring placenta for everybody tonight? That's what was on the.
There are people that
So these are the 3 stages. This is something you need to learn. All right, risk factors.
We had a Friday night for dinner.
Risk factors, we talk about antepartum and intrapartum. Antepartum means before giving birth. Intra means during. So things that we're concerned about before birth. Well, mother's age. Okay? Now we pretty much have increased this to 40. So we say till 40 is probably not going to be a problem. Less than 16 or greater than 40. If they've had previous miscarriages, there is more likelihood that they will have another one. Okay? So miscarriages are always a problem. Doesn't mean that they won't have, 10 or 15 babies, okay, throughout their lifetime. It happens. It's not an issue. Post-term gestation, this is a woman who goes over her 40 weeks. So we allow her to go to 42 weeks. Once she goes over 42 weeks, we don't want, it's like leaving the chicken in the oven for too long. Got to get it out. So that would be post-term gestation. Mothers that are on drugs or medications, always a problem. And toxemia we'll do much later on. I have a slide on that. Hypertension and diabetes. We mentioned very briefly gestational diabetes. This is something that a non-diabetic woman can sometimes get. There is a test for this during, months 5 or 6. They make them drink this whole bottle of this sweet, nasty soda stuff. Yeah, and they test how their body is dealing with that rush of sugar. During birth, things we may have to deal with. What?
What's multiple gestation?
Multiple gestation. Gestation means pregnancy. Multiple gestation means like twins or more than one at one time. Premature labor, obviously we'll talk about that. Meconium stained fluid, we'll do a slide on that later. Ruptured membrane, I haven't even mentioned yet the membrane, we'll get to that. Drugs and abnormal presentation, prolonged labor. So we have slides on all this stuff coming up.
We should move the slide away.
Okay, so
Antidepartment, does it matter? When you come in the...
My wife has all those.
So, let me talk about something else here that we need to explain. The baby lives where? In the uterus, right? Good. Now, the baby also lives in a special fluid at all times while it's in the uterus, and that fluid is called amniotic fluid. Yeah, there's a slide probably that says how to spell that word. Amniotic fluid. Okay? So the question you should be asking is why, when pregnant women walk, do they not drip amniotic fluid all over the place? Okay? So, there are two things. First of all, there is a mucus plug, alright, which holds most of it in. But the main reason for us that we need to know is that it is surrounded in the amniotic sac. Okay? So, baby is in the amniotic fluid, which is surrounded by the amniotic sac. It's a little bit like a thin sandwich bag. Okay? And all that is going on in the uterus.
So where's the placenta attached to?
To mom, to
No,
the
I'm saying-
uterine wall.
No, I'm saying to the sac.
Or it goes through the sac?
No, to the belly button.
The umbilical cord goes through.
Goes through the sac.
Yeah. Right? So, there are various emergencies that you will come across as an EMT. Okay? So, here we're going to start with some of them. Alright? This is called an ectopic pregnancy. We have a rule in EMS. It goes like this. If you have a patient who is female, of childbearing age, and she has unexplainable abdominal pain, she's got an ectopic pregnancy, no matter what she says. Okay? Because we always look for life threats. We always look for things that will kill somebody. Just like if somebody says they have chest pain, well, they may have a million other things going on, but we got to think about MI, right? Same thing. If you have a female patient with unexplainable abdominal pain, right? Not that she just came from Carlos and Gabi's, okay? That's explainable. We understand that. Unexplainable abdominal pain, and we have no reason why she's got this abdominal pain, we must consider as a number one thought ectopic pregnancy. What is an ectopic pregnancy? I'm going to explain. First, I just want to get that thought out there. So, the word ectopic has nothing to do with OBGYN. Okay? The word ectopic is a medical word that we use in cardiology. In fact, I use it more often in cardiology than I do in obstetrics, all right? Ectopic means not in the right place, okay? Ectopic means not in the right place. So what is the right place for the egg to meet the sperm?
Uterus.
In the uterus, right? Ectopic pregnancies typically find themselves in one of the fallopian tubes. Okay? This is a problem. It's a life-threatening problem for any female of childbearing age. Okay? Now, they can tell you all sorts of stuff. They don't know any men, they never saw a man, they never heard of a man.
Jesus.
Right? They're the Virgin Mary, whatever they tell you, we don't really care at this point, all right?
How's it spelled again? That slide?
Ectopic?
ECC.
But this ectopic has nothing to do with
It has- it
pregnancy
has-
at all? Like, what is
The
that?
word.
The word ectopic is not pregnancy.
But an ectopic pregnancy has a lot to do with it.
Even she says she has no clue, she's never seen a
Yeah.
man, and you're telling her she doesn't.
Basically,
She may have an ectopic pregnancy.
But she never seen a man.
We don't believe it.
Because it ruptures.
Don't
People
believe
say
her.
stuff.
Oh, you're saying she's just a full, okay.
Okay?
What point, what month, at what stage of labor?
We'll get to it. Happens very early on. Very early on. In the first month or 2 months, sometimes we get a call for the abdominal pain, usually on one side or the other, okay? And it's,
When would they feel it? At what stage?
That's what we just said.
about 4 weeks pregnancy.
They don't even know
But how
they're
can you tell if the person?
Sometimes they don't know they're pregnant,
But how
Because it's still
exactly? So how do you
because
know?
it's only 4 to 6 weeks. They don't even know.
But how do you know if they're pregnant? How could you
He said
say?
Oh,
They're
Just
complaining
check.
about any
because
abdominal
it's an
pain.
intense pain. It really
It's a risk.
No,
I know when they're having an
It's good that
ectopic
you know, but
pregnancy.
how do I know?
because anytime
I told you,
woman
if
that
a
age-
woman of childbearing age, that's from 16 to 60, or 12 to 60,
So
15 and
has unexplained abdominal pain on one side, we have to suspect an ectopic pregnancy. It's quite simple.
Is that baby not going to be born?
That baby is not going to be born. Here's a normal pregnancy. You see the fertilized egg down here? And here's an ectopic pregnancy. See that?
good pictures.
Could be better.
Isn't it the same thing as like a
Could be better.
gallbladder
You need that
or
better?
stone?
What?
The pain is the same as a gallbladder or stone?
No,
It's not the same, different pain?
different. It's lower down.
Lower down?
Yeah.
What happens, what's the procedure, there's like a surgery?
Oh, what happens? Yeah, they actually go in. She will lose the use of that ovary. Okay?
So
That's what you have, that's what you have too. Yes.
So if that happens twice, that woman's killed.
Got spare.
Right. Okay. So don't think this is not serious. These are very serious. Sometimes they'll have low blood pressure. Sometimes they'll have vaginal bleeding. Sometimes they won't. Sometimes they don't even know they're pregnant.
Sometimes it'll just hurt them a little bit on their side,
Yeah.
That's right.
and then you just. So yeah, okay.
Okay? Take them in. Abdominal pain, female, one-sided, no apparent, anything, reason why. Maybe an ectopic, this is easy to see with a quick sonogram. Okay?
Not that easy.
Yeah.
That happened to my wife. I missed it.
Wow.
We went to South Nassau, and this genius Kenyan doctor looked at the ultrasound, sent it off to some other radiologist. They all looked at it. They said, "Oh, you're fine." And the next morning, her doctor looked at the images, and she was rushed to the hospital, and it ruptured. She was hemorrhaging internally.
Well, that's
She gave them Ellie's business card.
really bad.
Yeah, so she lost the fallopian tube, and they had to.
That's what happened.
The surgeon showed me the images. The blood was clotting already. She was hemorrhaging for 2 days already.
Wow.
Is that always all happening? The fallopian tube rupture?
Yeah. And if you don't catch it quick enough, they'll just bleed to death.
Can you catch it early enough so that the fallopian tube is safe?
I don't know. I don't think so.
So internal bleeding won't always come with, you said, blood coming out of the rectum.
Right. Not always.
It'll just sometimes pool up inside, you never know.
Yeah.
The only sign of symptoms is pain, nothing else.
Again, you
That's
may
why-
have hypotension, and she may tell you she's got vaginal bleeding.
Right.
That's different. Obviously, you have to ask, is that different bleeding from your regular menstruation, right? Because obviously it doesn't mean anything. All right, let's move on. Let's not. All right, I want to talk about these two: preeclampsia and then eclampsia. Okay. Preeclampsia. Now, anybody? Obviously, some of you have wives that have had babies, right? And you probably know that she was supposed to go to her doctor once a month for the first 8 months or so, and then every 2 weeks, and then every day, and every week, and twice a day, and whatever it is. Question is, why do they go to the doctor so often? Why do they have to go every month, and then more than once? What is the deal with that? there's really only two things that they are doing that are important over there, okay? One is to take her blood pressure. Take her blood pressure, all right? If a female who is pregnant starts to have hypertension, okay? They also make her pee in a cup every time she goes, right? Anybody ever went with her?
Yeah.
It's true,
And I heard all
Sometimes
about
went without her, but that's
okay? All right, so they make her pee in a cup, they also take her blood pressure. Question is, why are they doing these things? So they're looking for the same thing, all right? We call it preeclampsia in pre-hospital setting. Doctors call it toxemia. Okay, I don't know if I have this. Had it before. Okay, doctors call it toxemia, we call it preeclampsia. It's the same thing. So we call it preeclampsia because the thing we can check is the blood pressure. So we can find this very easily. All right? So if a pregnant woman has very high blood pressure, over 160 over 110, okay? Higher than 160 over 110, she is pre-eclamptic. Okay? She needs to be helped, she needs a medic, and she needs to get to the hospital. Everybody understand that? Good. Now what are the other signs and symptoms of preeclampsia? So some of the ones that I want to talk about are here. Oh, why do they call it toxemia? Because they dip something in the urine to test for proteins.
So what is it?
If she has a certain higher level of protein in her urine more than usual, they will make a diagnosis of toxemia. We use signs and symptoms because we don't have a lab to test urine in the back of the ambulance.
And we don't diagnose.
Right. So, but you need to be able to know that she's preeclamptic. Let me just finish the signs and symptoms that you will often see. You will see this one, visual disturbances. All right? Her vision will become blurred, blurry, all sorts of strange things. Anything she tells you about vision, okay? I've never seen blindness, but they put it there. I've never seen that. But they will complain of not being able to see. Everything's blurred, everything's weird, everything doesn't look right. Okay? Nausea, vomiting, you can't really go with that because that is a normal symptom of pregnancy. So how are we going to know that this is the preeclampsia? Right upper quadrant pain. So this is interesting. Could be right, could also be left. But what they got right here is that it's upper quadrant pain. Not where you expect the normal pain of pregnancy, which is usually lower abdominal.
What stage of the pregnancy are they in?
What's that? Let me get through this. Headache, confusion, and respiratory symptoms. I'm not going with most of this stuff. The main ones I want you to know are high
Blood pressure.
hypertension, high blood pressure, visual disturbances, and this upper quadrant pain.
Do you feel high blood pressure? Does a patient feel it? Can
They
tell?
sometimes can,
What
yeah.
is it? Do you know what it is? What it feels like?
What is preeclampsia? What is it?
It's
a condition. No, I understand, but what is this condition?
High blood pressure during pregnancy.
I get that, but what is it?
When I was sick.
That's all it is for now.
It's just a condition?
Condition.
It
Just
Okay?
take her in, there's nothing.
Yeah.
My head hurt.
No, there is something. Get medics. Recognize it and get medics. We'll treat it. Okay?
But are you gonna say, we're not gonna know what it is?
No. Next. Let me move on. If preeclampsia is not treated, and just left alone, it will turn into eclampsia. Okay? So preeclampsia followed by eclampsia. We use these two terms. You need to know the difference between them. Okay? Eclampsia is all of the signs and symptoms of preeclampsia, but you won't see any of those. You will see seizures. Okay? So when you'll be asked questions on exams and quizzes between the difference, what is the difference?
Seizures.
Seizures, right? So if they mention seizure in their vignette, their little, you know,
it's eclampsia.
Yeah.
right? If they mention seizure, then you know it's eclampsia. If they don't mention that, then it's preeclampsia. Okay? And these are important. Okay? I don't know if any of you were old enough to remember the famous case that happened in Metro Tech, the foot of the Manhattan Bridge, the FDNY EMS headquarters. There were two Fitney EMTs who were getting coffee. Anyone remember this story?
Yeah.
They called them and they said, there's a pregnant woman
Dunkin' Donuts.
over there. Can you come and help? And they turned around and said, we're on a lunch break. Okay? Wearing the full regalia. EMT, fire department, patch, the whole 9 yards. We're on a lunch break, call 911.
Aren't they 911?
They are.
No, they're not one on
They
the lunch
weren't
break.
89.
Get the
They weren't
difference.
89.
Okay? They were dispatchers or something, but they're still EMTs. All right? The person called 911. All right? It took, of course, how long?
40 minutes.
20,
Yeah, about 10 to 15 minutes for a truck to get there. Got there, patient went from preeclampsia to eclampsia and died.
Wow.
Okay? Died. Mom, baby,
Over a cheeseburger.
over coffee.
Did they get charged?
Yeah, it's a whole long
Huge
story what
scandal,
happened
huge
to them.
scandal, yeah.
Not for now. So, understand this. You see that? I'm giving you numbers. 160 over 110 is a good number just for yourselves to know. That's called hypertension. If she has blurry vision, or what we call visual disturbances, upper abdominal pain, she can just have one of these, or none of these, as long as she got the blood pressure. Okay? Preeclampsia. Don't let it become eclampsia. Okay? Medics will treat both pretty much the same way. We don't treat eclampsia as we would do somebody just having a seizure. Different medication, different method. But that's not for tonight.
Is there anything for EMTs to do?
How would you know the difference?
Yeah, call medics.
How would you know the
Shraggy didn't get the memo that there's no questions tonight.
How would you know the difference, the eclampsia and like a seizure? I mean, you know the difference, but like, is it
Pregnant.
You said 4 weeks, 2 weeks.
No, I didn't.
that
This
was-
is
oh,
later
that's-
on. That was for the ectopic.
Got it.
Next, let's move on. A non-emergency, just something you should know about. It's called Braxton Hicks contractions. Okay? Sometimes, you know, they say God has a sense of humor. So, sometimes before they start having their contractions, they get contractions prior to the contractions. Okay? They're not real. How do we know they're not real?
Because we say Shefel, go back to Schluffy.
Okay, but how do we know they're not real?
He's not near term?
Because there's
No,
no
they
dilation.
should be
There's
close.
no dilation.
Very good. Shraggy, on the head.
Yeah, but
No cervical dilation. You won't know
They don't
this.
know that.
You won't know this.
My wife
You
told the
also
doctor that
you
because I
won't
said it's
know
Braxton
this.
Hicks.
You also won't know if they're Braxton Hicks or not.
Right.
You won't know. I'm just telling you that sometimes you transport women to have a baby and then you see them as pregnant as ever, you know, 3 weeks later walking around. Okay? So, that's why she's crying, I guess, because it didn't help and whatever. Now, way more important.
Crying or
Maybe they just
sweating?
work fast.
She's crying because you have to
After
run out of
3
the
weeks.
hospital.
The question about the preeclampsia, people who have that know they have it, and it comes up again and again? Or it could
No.
be a fluke,
Oh, it's a one-time.
could one time happen.
They're treated.
So the patient, in other words, these are all things that the patient would have no idea that they can't give you any information.
Right.
Would
Right.
you
They'll
get-
give you no information.
But would you?
If
could
they tell
get
you
it?
they're pregnant, that's good.
If you have a history of it, would it?
Yeah, maybe.
But,
So if they tell you, oh, I have a history of preeclampsia.
Yeah, that would help.
But not necessarily is it a carryover thing.
Right. Let's move on. Supine hypotensive syndrome. Now, this is probably my favorite pre-delivery problem or emergency. And the reason is because this is caused by whom? Who causes this more than anybody else?
She does.
EMTs. EMTs cause this problem because they don't listen or they were never taught it.
Also,
They weren't
some-
I'm not, don't know whose fault it
Some
was.
medics also. Some, you know which ones I'm talking about.
No.
The ones
So-
that are maybe fine.
Here's the deal. Every pregnant woman knows, right? They read the book, right? What to expect. They got the magazine, they get the memos, I don't know. They know. They know one thing. Don't lay on your back when you're pregnant. They know this. You just ask them. They know. They know. They're not supposed to sleep on their back. They're not supposed to lay on their back. However, EMTs don't know this. EMTs think everybody is placed supine or semi-fowlers. Okay, so what's the problem with supine or semi-fowlers? I'm not sure if you can see, but here's her pregnancy. Thank you. What vessel is that?
The placenta?
Inferior vena cava.
Excellent. Wow.
Wow.
Wow. Very good. That is the inferior vena cava. And look what's happening to it.
Should be blue.
Right? It's getting compressed against the
Spine.
spine because she's laying on her back.
Freaking name that goes down.
It says it on the thing.
It does?
Now, look what happens when you put her.
Oh, fine.
Look what happens when you put her left lateral.
If I told you, you could
It relaxes.
It does not say that.
It does, I didn't realize. Definitely not fair.
What does it say?
It says inferior vena cava.
I can't see.
There's no way he could have seen
I can't
that.
even see the man on the board. How does he see that?
There's no man on the board.
Is he having visual disturbance?
Yeah,
Okay, guys, listen to me.
I think he's being preeclamptic right now.
Listen to me. Guys, listen to me.
No, it's.
So that's
Yes,
after covered.
okay, so you know, your wife's not supposed to lay under.
Well, that I know, but I
So she's
didn't know
supposed to be
that
right
shit.
right
I
lateral?
honestly had no idea. I think she slept on the back.
So,
Wow.
when we transport, and I'm talking about the taxi job transport, not the imminent delivery. We haven't got to that yet, okay? We're talking about the one that meets you at the front door with her coat on and her bags, you know, bags are packed and the husband schmuck is schlepping the suitcases, right? Okay, I'm talking about that one, the taxi job, right?
Who made this like very this picture?
What, is there a problem with that?
I'm just curious if that.
That was me.
Okay.
Is that okay?
EMT school. I thought everything was very
He was
good.
the husband from last week. So.
Williamsburg EMT.
Right, so, thank you.
Oh.
So, do not place pregnant women supine, okay, if all you are doing is transporting them to the hospital. Is that clear?
Clear.
You're not gonna make this mistake. I have this fantastic story where I was woken up in the middle of the night for the pregnant woman who was hypotensive, okay? I knew what I was gonna see when I got there. I knew it. Okay? I get onto the bus, and I'm not a happy camper. Okay? I got this shamu laying there. Okay? Laying there on the stretcher. Okay? She's 14 months pregnant, right? And she's supine on the stretcher. So now I'm not happy. Okay? You can imagine.
And you got woken up in the middle of the night.
Yeah, I'm not happy. I tell the two EMTs, I say, watch this. I'm going to teach you an advanced piece of medical knowledge now. Watch. Okay? And I take her, right? And I roll her over on the stretcher onto her side. I said, you take her blood pressure in 2 minutes, and you send me the numbers. And I left. Okay, and later I dealt with them. Okay.
You don't wanna-
My wife's
you don't wanna
delivery
mess-
room.
I wouldn't
Wife's
want
in
to-
the
I wouldn't
delivery
want to
room.
bust
She's either supine or semi-fowler, and they're not.
Delivery. I'm not talking about delivering. Did I mention delivering?
No.
I said when you're doing the taxi run, and she's having nothing more than Braxton Hicks. Okay, and she wants to go, she's there with the coat, and she's ready. Right? Didn't I make this clear?
With the Mishpacha magazines and her husband.
Yeah?
Yes.
Good.
Fine.
This is how they get transported.
Naked.
Left, obviously. Left or right lateral.
Oh, all right.
Yeah, left is always better, but yeah, either way.
You can't
As
let her
long
just
as
sit?
it's not like that.
You can't let her just sit if she wants to sit. Like, sit on the bench.
Generally in the ambulance, we don't really want people sitting, but yeah, if she wants to, you
You
could.
can strap them in that way?
Yeah.
Sideways?
Absolutely.
Underneath,
Absolutely. Next, a couple more emergencies that you need to know. And again, when they give you a little story, you have to be able to differentiate between them. These are very easy, but the words are very difficult, okay? The first one is called abrupto placenta. Abrupto. What that means is that the placenta has separated from the uterine wall, okay, and is now bleeding, all right, all around over there. This is called, what did I say it's called? Abrupto placenta.
That's supposed to happen, just not, I guess not at that point, right?
No, it's not supposed to happen until the baby's delivered.
Delivered, okay.
The next one that happens, and this one also is pretty bad, this is called placenta previa. Think of previous, the placenta
First.
is first. Is there any way this baby's getting out?
You have to pull the placenta out first.
Yeah, you can't. You can't get the placenta out of
And
here.
then the umbilical cord is attached.
Okay, this is a section. Okay?
Yeah.
Alright? Very rare, right? I don't know if these numbers are even true anymore. But just know the difference between the two.
Do you know Dr.
How do,
Kafidas?
how do,
He's
how
like
do,
the
how do we
specialist.
know?
on
We
this.
wouldn't know that the placenta.
Right.
Yeah.
But how would they know in the hospital?
Sonogram.
Sonogram.
Now, in the abrupto, they would need a C-section?
No, maybe not.
That they
Maybe.
induce?
Maybe, yeah.
But the baby's gotta come out.
Yeah.
Yes,
Doctors like the C-section.
Alright, here, you like my joke?
No, I
Yeah.
can't.
How would mom know
I
that
like
the
the joke.
placenta separated?
Blood.
Bleeding.
What does it say?
I think my water broke.
And there's ice in it. There's ice scoops.
These are Eskimos.
Or she's.
Alright,
Oh, she's what?
focus history and physical exam. Okay? So some questions that you may need to ask. The first one is probably the most controversial. Asking a woman, are you pregnant? Okay? Many men have got into a lot of trouble asking this
A lot of
question. Okay?
Yeah,
Well, let's say you've established that she is, or she was nice enough to inform you when you got there. How far along are you? Now understand this. In medicine, we count pregnancy in weeks. There are 40 weeks of pregnancy. Women count pregnancy in months. Okay? So, they never really know which week they're in. Also, when they say they're 3 months, sometimes some of them say they're 3 months because they just entered their 3rd month. Some of them say they're 3 months when they're
Haven't.
about to enter their 4th month. So there really is, they haven't really got together as a group and come up with a
So
real,
Some count it from conception, some
Yeah.
count it from
yeah,
positive test.
yeah. There's also,
Diagnosis.
it's just a mess. So you never really know, I'm just saying.
You know,
One last period.
That's when it's
Do you
supposed to be
need
counted.
some
That's
sort
the
of
age- that's the age of the
consent, or is
embryo.
this your
No,
consent?
even how long.
Like when you start
how long
talking
counts,
these
long
questions, is
counts,
that in
counts.
itself consent to
To do what?
Deliver the baby.
deliver the baby? I don't know, I'm saying.
No, forget about that for
Consent
now.
And to make them feel more comfortable, would you say like, where do you keep your veins, where do you keep your womb? Like,
No, that really doesn't work like that.
Where do you keep your baby?
Are there any pains? Is she having any contractions? These are good questions to ask. Bleeding or discharge? Okay, we ask this question all the time. Here are a couple of words that you may see. Prima gravida, multigravida.
it's a military.
Prima gravida means the first pregnancy that she's ever had. She's prima gravida.
Even with the miss.
Multigravida means
More than one.
she's had, many. Then there's, want to know how many live births? I'll explain to you a system that we use for this
I was gonna say, how do
afterwards.
you remember?
I'll explain to you a
There's
system.
a chapter in the book that.
Abortions, has your water
Ask the
broken?
questions, how you're supposed to look at words and do the
Facebook
stuff
Live.
so the pre-
I'll show you something about this later.
Chapter on that.
Guys, listen. Do you feel like bearing down or pushing or need to use the bathroom? I typically don't ask this unless I need to. Very often they will tell me this. That they need to move their bowels, they need to go to the bathroom. At that point, that is a sign that she may actually be having the baby. Okay, so we'll talk about that in a minute. Have you had prenatal care? And we do like to ask your LMP. That's what it's called in medicine. LMP, last menstrual period. We like to know that because then we can maybe get a better idea of how far pregnant she is.
Unless they're 7 months pregnant, they're not gonna remember that.
Very often they do.
They haven't written down all of it.
But
Okay.
that helps you?
Yeah.
Is it 7 months pregnant, did I tell you that?
Yeah, because I don't know, they know what 7 months means.
Could be the end of the 7th month, the beginning of the 8th month.
Right.
But they were counting it not
But
from
for
the
you,
last
Adam?
days.
I want to know in weeks. I want to know how many weeks they are. Okay?
He's gonna push it back in, or
We'll talk about the physical exam soon. All right, so this is the question I think I'm asked more than any other question. Okay? Even EMTs, they ask me this all the time. How do you know if she's going to deliver the baby there, right there on the spot, wherever you are, or if you have enough time to get to her hospital of choice? Okay? Sometimes it's very easy. Sometimes it's very difficult. But there are some key clues that you can use. All right? One thing you want to prevent is the umbilical bungee. Okay? I once had a woman walk to the ambulance with the baby attached, bouncing on the sidewalk. She's walking to the ambulance. Baby was between her legs, still attached to the umbilical cord. Yeah. Okay? That's the umbilical bungee. All right? Not
Does she
good.
know?
I don't know what she knows.
Good black.
Right? So what are we doing with this, lady? What is with imminence of birth? How are we going to know what's going on? We need some idea. We need some clues. So here they are. I'm going to start with this one. If mother is multigravida and she says the baby is coming,
The baby is.
the baby is coming.
What's multiple?
She's had more than one pregnancy. All right? You believe her. Okay? Believe her. All right? They know. They know better than us. They know better than doctors. They can feel it. They've had one before. Typically, they know. Take their word for it. You know how I always tell you don't listen to a thing the patient says, right? Because they don't know what they're talking about.
Not a pregnant woman.
This they do. Pregnant women know what they're talking about, all right? So, that is a very good sign that she's probably going to have the baby, all right? If it's her first baby and she's telling you she's having it, she hasn't got a clue. She doesn't know what she's got in store. We'll get to crowning in a minute because that's a definite sign that you're going to deliver the baby. Okay? Contractions 2 minutes or less apart. When you're calculating contractions, there are 2 things you need to time. You need to tell her, tell me when a contraction starts. You need to time the length of the contraction. And then you need to say, tell me when you get the next one. So when that one finishes, start timing again and see when she tells you she's having another contraction. So we're looking for 2 numbers, all right? When contractions are less than 2 minutes apart, each one lasting for 45 seconds to a minute, she's imminent. She's going to have the baby very soon. Okay?
So
Yes,
the
if they're
first one
30.
lasted 45 seconds until and then the next one?
And then the next one was less than 2 minutes after that. Okay? So you can just ask her to tell you this. This, again, she knows. There's no way you can know. You'll see her grabbing onto whichever person is near her or, the side of the stretcher or whatever. But you want to ask her, tell me when, you can see when they're having a contraction. Again, if she feels the need to bear down or wants to move her bowels, don't let pregnant women go to the bathroom, okay? Don't let them, okay? If they just want to go for a quick whiz, maybe. but don't let them go to the bathroom properly, because there's nothing worse than having to drag a baby out of a toilet bowl, okay, while it's still attached to mom who's still sitting there and whatever. So it's a real mess. So if they think they're gonna need the bathroom, it's okay. Your whole ambulance becomes her bathroom, okay? And crowning I'll get to, okay?
What's the word?
So prior to delivery, I'll show you one of these on a skill night. This is an OBGYN kit. This is some of the contents of the kit, all right? I'll show it to you. You will get to see it. Over here is a scalpel. That's what Hatzalah gives us. Fire department actually gives surgical scissors, which are way better than the scalpel. I'll show you both. Hopefully I'll get them from my other class and bring them over here.
To cut the placenta?
Yeah, no, cut the umbilical cord. We'll talk about it. So try to maintain mom's privacy. I once walked into an apartment building and there was a woman laying in the hallway. In the hallway, she's laying there, spread eagle, telling me she's having a baby. And she was having the baby. I told the EMTs, get me a board and a blanket, okay? There was like an Alfred Hitchcock movie type apartment building, okay? The light was flickering, it was dark. Kid you not. I said, get me a board, get me a blanket, okay? We got her, I made them carry her all the way downstairs, because there was no elevator, for whatever reason. We got into the ambulance, literally closed the doors. She says, I need to push. I'm like, go right ahead. We're in a somewhat clean ambulance, but there's light, and we were able to see. Okay, it makes a very big difference. I'll explain how I saved that baby's life by bringing it into, having her give birth in the ambulance. I'll explain soon.
What?
Position mom, okay, so, yeah, she should be Fowler's, semi-Fowler's, all right? Supine, usually not, but this is the way you want her to be. Again, if she's in her bed, if she's in your stretcher, your ambulance, it all depends. Make her comfortable, okay? She doesn't have to be on the left side or anything like that if you are delivering. I always advise every EMT, take 2 of these OB kits into every possible delivery. And the reason is, these are not really prepared with the highest quality of materials. Very often parts of these will fail. Very often you just need more than what it gives you. So my rule of thumb is take 2. Always have 2 of these. And I open usually 2 before as I'm getting started. I use 2. Okay? I'll explain why later.
Yeah, you and your $80 waxings.
Yeah.
Do you wear a gown and goggles?
I do not, no. I'll tell
You wear
you,
gloves?
Is there something different a medic could do than an EMT over here?
well, not yet.
Meds.
Not yet.
That's afterwards.
Issues with the baby or
True story. An EMT once asked me, what should he do? Because when he delivers a baby, he gets blood in his eyes. I told him, you are way too close. Your face is way too close if you're getting blood in your eyes. I mean, please. So, this is crowning. Crowning means that you see the baby's head at the vaginal opening. You see the baby's head. Now, sometimes it plays peekaboo, okay, and it comes out and then it goes back in. This is known as false crowning,
Very doggy.
but it will right away. It will right away become crowning,
Another 8 weeks to spring.
and you need to deliver this baby. You're not going anywhere when you see this.
Is that very dangerous once the crayons goes back in?
No,
Doesn't the whole system flip itself around?
No. it's just fine.
Well, it depends why it's happening. It could be happening because the umbilical
said
cord is
you're
wrapped
guaranteed
around.
to
That's
get
why they
head
No.
You're not
What?
guaranteed to get head first.
So that's the umbilical stuff.
We're talking about
Still
normal
mothers.
deliveries. Good. Some precautions: do not touch the vaginal area. Okay? You cannot do internal examinations in the field. Don't touch unless you believe, or she believes, or she tells you that it is imminent, in which case you're going to check for cramming. Don't allow her to go to the bathroom. Don't hold her legs together and say, keep it in. If delivery is imminent, stay on site.
One of my kids, the doctor told us there. I said, no.
Okay? Don't do that. If delivery is imminent, and we know now what it means to be imminent, right? You have crowning, or you have the need to bed down, or you have the
Within 2 minutes.
contractions lasting for about a minute, every minute or every 2 minutes. Is Ma diabetic? Has she been an intravenous drug user? These would all be reasons that we want to move.
You mean, don't let her go to the
What does that
bathroom, don't let
mean,
her go to the restroom?
You skipped the one about incurring 10 minutes, that one? Is that correct?
It means if you wait 10 minutes, nothing happens. You should have medics coming anyway by that point. Right?
What does it mean move?
So
Like
basically,
that?
she's getting delivered.
So,
No, she did.
EMTs actually deliver, New York City EMTs deliver more babies than medics, usually.
What does it mean move if she's diabetic?
Medics take too long.
It means that it's got to be dealt with in the hospital.
No, it's all.
The what? Because she's you're not stopping her from having a baby.
No, it may happen quicker.
Oh, it may happen quicker.
She's diabetic.
And that's
So this is normal delivery. This is normal delivery. This is called a cephalic delivery. The baby's head appears first like this. The hardest part to deliver when you're delivering is not the head, it's the first shoulder. That's the hardest part. So what we usually do is we rotate the baby. Once the head comes out, we rotate it to allow the first shoulder to come out.
Rotating using which body part? The head?
The head and the neck, yeah.
Oh my gosh, you've done this?
Today? Twice.
Right? In the shorter place while he was picking up his dinner.
Two things we're gonna look at.
Dinner break.
Cord around the neck and unbroken amniotic sac. We're gonna look at these two things.
She's better than OBGYNs.
So, as the baby's head is coming out, you need to suction the mouth.
You don't wait till it comes out?
What?
You don't wait till it's out completely?
Right? Wait for the head and suction the mouth and nose. You need to keep the baby dry, and that's really very important because the baby's skin is not really mature enough to do its work and to do thermoregulation. So one of the most important things is to keep it dry and warm. Why are we worried about wet?
It makes it cold.
Because it makes it lose
20%
temperature, right?
faster.
Good. So once the baby is out, we're going to cut the cord. Okay? Now this is what we have. These are the clamps we have. They're made of plastic. They very often break as you're using them. They won't clamp. So it's good to have 2 extra. Only 2 come in each pack. So it's great. The main thing here is, you see I have all these inches and things. Don't start taking out rulers and measuring. The main key point that I want you to understand is don't clamp it over here. Okay? Leave the medics some umbilical cord. Alright? Because we may use it. There are veins and arteries in there. So don't clamp it over here. Okay? Clamp it over here and a couple inches away, a second clamp. Alright? These are the types of clamps, but these are the ones we actually have. These are similar to the fire department surgical scissors. In Hatzalah, we actually have a scalpel. This is what the kit that they gave. This kit also, where we had a picture of the kit, here, this is a scalpel.
What are the other things that you have there?
Well, we'll show you. This is a suction, these are the clamps. There's a sanitary napkin, which we didn't get to yet. These are 4x4s, and there's a bag to put the placenta in, some wraps for the baby and drying stuff. Everything's in there. You'll see it. I'll show it to you on skill night. Okay? So clamp and cut the umbilical cord. All right, again, this is with no problems, no issues, everything's healthy and happy, and that's what you do. So 2 complications of normal delivery that every EMT must be able to handle on their own. Handle on their own. Medics are on the way, we're not going to get there in time. The baby comes out, and you see the head comes out, and the baby looks like a bank robber with a stocking over its face, okay? There's a problem here, all right? This means that they have an unruptured amniotic sac, okay?
That means that the water didn't break?
That means the water didn't break, yes. Now, what you have to do is break the sac. Do not use any scalpel or any metal. Don't take out your trauma shears and start cutting at
What's the
it.
fire department thing?
Yeah, jaws of life. No. You can break it with your finger. It's like a thin sandwich bag or saran wrap. Just break it. Don't put your finger right into the baby's eye. Okay? Think what you're doing. The other thing that EMTs don't understand is when you break the sac,
It's gonna make a mess.
it's going to make a lot of mess. There is going to be amniotic fluid everywhere. So if you do it over your knee, guess where the amniotic fluid is going?
Over you.
If it goes in the eye, it's too close.
That's it, right? So use common sense. Do everything at arm's reach. Okay, you shouldn't be that close. So the baby comes out, looks like a bank robber. It's got the amniotic sac still attached. You need to bust that sac, let the water out, let the amniotic fluid go. Okay, this is normal rupture of the membrane. And where will the water go? Through the cervical arch, through the cervix, and will spill out all over the place. So remember, that is part of what's keeping it in, that cervical, that,
Does it make a difference where you puncture it, or?
no, just not in the eye. When the head comes out, do it by the neck. Okay?
What happens to the sac? Like the sac just just disappears?
Just, yeah, it just
It
goes away.
evaporates.
Yeah. It doesn't evaporate, there'll be something left.
It falls apart though.
Yeah, it's
Yeah.
tissue, it's human
when
tissue.
when you bust a water balloon, what happens to the balloon? There's like a little particle somewhere.
Yeah. Okay?
But mostly just water. And
It gets left in the grass, basically.
I don't know if you can see this
You're not
picture,
worried
it's a very
that the
good
sac is
picture,
gonna-
but I don't think you can see it.
You have to tear the whole thing, like make sure you rip the whole thing.
No, once you puncture.
You're not worried.
Oh.
Oh, I did that.
Yeah, but then
Yeah,
it's
my son has
in a bag.
So-
Nate, what do you mean you did that?
Yeah, I did that.
Oh, yourself.
He was the baby,
Yeah.
yes.
Oh.
My
So-
son
rotation?
was all wrapped around him.
Reach, right?
The other issue,
No, when I was born.
the other issue that can occur that an EMT should be able to deal with easily is called nuchal cord. Okay? This is where the umbilical cord is wrapped around the baby's neck. Now, when it's in utero, does it matter?
No.
No, because it's not breathing using its own respiratory system. Soon as it comes out and the baby gets stimulated, now the various holes that the baby has in its heart and everything will close and cause its respiratory system to start. But if it's being strangled by its own cord, right, that's a problem.
Another problem is if it's tied around the neck, then the lead way is shorter,
You have no
and
slack.
it starts pulling on the
That's
other
not a
neck.
problem.
kid was
It's very
having
common.
Have you ever had a situation where you had to cut the unruptured sac and then had to move the cord?
No, I never had both.
My
I've
kid
had
was
them
born like this.
individually. So,
This happens very often.
this happens very often, both of these, and that's why every EMT should be able to deal with them. So, what do? Alright, so it's very simple. You put your fingers under the cord, and you lift it over the baby's head, okay? And that's it, the baby will continue. So as soon as the neck shows, as soon as the neck delivers, the first thing you want to look at is the neck, okay? Now, the reason that I said that I saved that woman's baby's life is because that baby had nuchal cord, and there is no way I would have seen it, no way, in that dark, dingy hallway. So thank God we got it to the ambulance. It was bright, it was light, and we saw it, and I was able to get it, slip it off.
What if it's
Now
too
there
tight?
are times when it's too tight, and you cannot get it off with just with your fingers. Very easy. You just pull on it, put a clamp, pull on it somewhere else, put another clamp, and cut
You
it.
kind of, oh,
Cut it there and then. Once the head is out, you can cut it. Okay? That's it. Simple. Post-delivery. The most important thing you can do is keep the baby warm. In hospitals, they get a little hat. We don't have those hats on the ambulance. It's a real shame.
Not enough room.
oh, there's a-
Really?
We just don't have them.
So give him your EMS hat,
Give
guy.
them
Stop it, Sarah.
Give me your
Yarmulke.
dressing. What's the gauze dressing for the arm that goes? You can use one of those. Just tie the top. The one that holds.
Splint this
The one
head.
that holds the bandage in place.
Or the latex glove.
Tourniquet? I don't know.
A triangle.
That's what they make them in the hospital.
A triangle bandage.
It's like a sock, and they just tie the top.
No, it's an actual hat in the hospital. I'm not sure which third world hospital you're
My
using.
kid was born in the bush in Botswana. So.
There you go. Apparently.
I thought that was me.
I like James gives hands.
Normal bleeding. Normal bleeding will be about half a liter. That's 500 cc. That's 500 ml, in case somebody asks. All the same. All right? They do give you a sterile pad that the woman, you can put over the vaginal opening. Okay? And we're going to talk about massaging the uterus and nursing the infant. These are all things that will help stop the bleeding. We'll talk about that in a minute. I think I have a slide on it. Maybe I don't. All right, we'll see. To stop the bleeding, you need to do you need to let mom nurse the baby as quickly as possible. Okay? That will help stop the bleeding. Not explaining why, but it's to do with the hormones. The other thing is to massage the uterus. Now, this is why they're supposed to have a doula. Okay? Because after I've delivered her baby, there is no way I'm rubbing her belly. Okay? I will not do it. It's too weird. It's not happening. Okay? So I've given a woman her own hand and said, here, rub here.
You don't rub
Okay.
it, what do you get, dreams and aspirations?
Yeah, I am not rubbing it. Okay? There's just no way.
Medics wouldn't, EMTs wouldn't.
I don't know. I don't know. It's too weird. I'm not doing that. Usually there's a doula, which I gag her in a corner until I'm done. Then I let her come into the picture, and here, I have something for you to do. Now, in the hospital, they do a uterine massage, but they do it from the inside.
Oh.
Okay? Yeah, you need a waterproof watch. So they massage from the inside, all right? And you're not supposed to do that in the field, okay?
Shut you heard that?
They have a machine that goes in and rubs?
No, they use their hands.
They use a hand? I've never seen this before.
You weren't watching?
You don't have Dr. Jacob, do you?
No.
She does?
Oh, she dives in.
APGAR.
She gets blood on her glasses.
APGAR. They will ask you what APGAR is used for. Okay? I would not bother learning this right now or ever. APGAR is used for checking the baby post-delivery, all right, to see how healthy or not it is. I will teach you the way I want you to check the baby after it's born. Okay? This is APGAR. It's very antiquated. I don't think much of it. Everybody asks it. Every hospital, every nurse.
What are they gonna ask you?
What?
They say,
What's the
what's
app?
that?
What's the APGAR score?
We say, we
Just
don't know.
make one up. Never 10.
Just don't say 83.
No, the max is 10.
No, it can't be an odd number.
You can.
Don't rush him and say GCS 12 and APGAR 82.
I've got 110 over
Don't
80.
say 0, right?
No.
Don't bring in a guide and say give an app card.
All Alright, really important slide. Really important. So listen carefully. This information comes from the Neonatal Resuscitation Program, which I was a part of many years ago. It's very important, and really EMTs are not taught this. EMTs are not taught this. I want every EMT to understand this. It's very simple. There's one vital sign that you need, that you will base your next move, your plan of treatment on, as soon as the baby's born. So your baby's born, we're gonna clean it, we're gonna stimulate it, we're gonna rub it with the appropriate towels and whatever we can get our hands on. Everything has to be clean, everything has to be sterile. We're gonna suction the mouth if we need to. After we've done all that, we're gonna keep the baby warm, okay? And then we need to find, as quickly as possible, after all that's been done, after you cut the cord, we need to find one vital sign. And the vital sign I want you to use is the heart rate. How do we get a heart rate on a brand new neonate that's just born? Well, what I want you to do is, there are different ways. There are different ways. You can feel at the base of the umbilical cord and feel for that pulsating. What I suggest, what I do, is I take my stethoscope and I put it right over the baby's heart. It's very loud. It's very loud and it's very fast. Okay? All you need is a heart rate for 6 seconds. This is the only time you can do this, because it's so fast. 6 seconds. Whatever number you get in 6 seconds, put a 0 on the end. Now you have a heart rate. So if you got 16, what's the heart rate? 60. How easy is that? Pretty easy,
What
right?
is normal?
What is normal? We'll get to it. Relax. Too many questions. Let me do the slide. So, you all understand? This is what I do. I put my stethoscope, I put it right over the baby's heart. You will not hear lung sounds. It's very hard to hear baby's lung sounds. But you will hear heart. It is big, and it is beating, and it is strong.
It's fresh.
It is here,
Yeah.
ready to
A fresh
go.
machine.
Okay, you can hear that really well. So, there are 3 types of babies that are born, and that's what we're going to look at really quickly. Ready? Baby number 1 has a heart rate of greater than 100 beats per minute. This is a healthy baby. That's it. If it's greater than 100, healthy baby. We do blow-by oxygen for this baby. Blow-by means no mask over the face. You take some oxygen tubing, plug it into your oxygen, put up to 4-6 liters, and then put the other end, where the oxygen's coming out of, just somewhere in the wrap, so it goes in near the baby's mouth, not in the baby's eyes. No oxygen in the eyes.
They do that in the hospital, I think.
That's
Or put a
great.
nasal cannula over there?
No,
No.
oxygen
Just
tubing.
the tubing.
Tubing. Okay? So we understand that?
Yeah, we do.
Healthy baby. This happens every morning. 2. Now this baby has a heart rate of less than 100. At the same time has a heart rate of
1 6.
greater than 60. You will take a neonate BVM. Every EMT should have access to one, either in their kit or on the ambulance. Neonate BVM, I will show it to you on a skill night. It's a very small BVM.
We didn't have one on our ambulance. We had a peds and we had an adult. We
Okay.
didn't have an
You're supposed to have a neonate one.
Okay.
And you will bag the baby with oxygen, 15 liters. How often will you bag the baby?
Every 3 seconds.
Every 3 seconds. Excellent. Okay? 3rd baby is the sick baby. This is a baby with a heart rate of less than 60. That means that in your 6 seconds, you only heard 1, 2, 3, 4, or 5 beats. Okay? Understand? You need to perform neonatal CPR. Now, it's a new CPR that you don't know about. This is at a rate of 3 to 1. 3 compressions, 1 breath. You need 120 events in 1 minute. 90 compressions, 30 breaths in 1 minute. It's fast. You'll do the two finger encircling technique, and your partner's doing literally 3 to 1. It's the only time you use this
3 to 1
number.
and what?
You don't do a full thing though, do you? Because you don't want to put too much.
Right, it's a
3 to 1.
neonate
How
BVM.
much, oh,
I will show it to you,
What's this different size?
different size,
That'd be one-
tiny
one
weeny
single
one.
3 to 1
If
for
you're the
what?
only one there, you don't have a,
If you got through the delivery and still nobody else alive?
Just right, go home.
you go to this
Sorry,
side.
get in trouble.
Meaning what's the
For
most
2 minutes,
compressions
I won't
is
do
it?
it.
Compressions. But the baby needs bagging.
What'd you say, 3 to 1, and then you said?
3 compressions, 1 breath.
And then you said.
Okay,
for how-
what if you are,
how
though?
much?
So you need 120 events in 1
Could
minute.
the mother help you in case of an emergency?
She just pushed out a baby.
Okay.
What more do you want from
Does she
her?
want to keep that baby? She should probably help you.
Okay? You understand these 3 types of babies?
Yeah.
Make sure you know what to do. Okay? You have a test question, what are you looking for? Which vital sign?
Heart rate.
Alright. Figure out what to
Don't
do.
tell Mandel that.
This is called the neonatal resuscitation triangle. This triangle is upside down.
Oh, really?
It is. It's upside down for a specific reason. Because the base of the triangle, which is now the top, is showing that every baby will need to be in warm, dry position, suctioned, and stimulated. Every baby. Okay? And that's why the white part now is at the top. Okay? Some babies require oxygen. Some babies need BVM or a medic to do endotracheal intubation.
Have you done intubation on a neonate?
Yes. Some babies, even fewer, require chest compressions, right? All this is BLS so far. And the fewest of all, the rarest,
ALS.
Wait.
ALS
Right,
medications.
not the
So what is
It's
this?
not BLS.
Well, okay, BVM, we put it all together, right? So what this is saying is that it's very rare to need this sort of help. Very rare. Okay? And most medics, unless they're part of the neonatal resuscitation program, will not really be much help. They will just lose it.
Great.
No, it's not really taught properly unless they're now teaching it as part of the medic course. I haven't taught one for a while.
It's a separate certification. for
It is,
neonate
yes,
resuscitation.
yes.
What signs would
For
need to
medics, it's a
medication?
separate add-on.
If all of this didn't bring the heart rate up. We're still looking at the heart rate.
After how many
It's one
minutes
note,
would you
but you have a
determine
checklist of things you have to do,
medications
right?
are?
Oh, I'm not gonna wait. If you've been doing compressions for 2 minutes, a second set of 2 minutes, I'm starting medications while you're doing, yeah, I'm gonna
And
start getting the
how would that be
line.
given? A line?
I know, right?
No, you have to do it on an ambulance.
How do you
Getting
find
a
that
line
vein?
neonatal?
It's really easy.
How do you find the vein?
In the umbilical cord.
Oh.
That's why I don't want you cutting it all the way down. I wanna be able to, if I need it.
stick with
Too late,
medications,
Don't-
they do.
I'll get in the
umbilical
refresher.
cord.
Look at the refresher. That's why he wants you to leave
There are,
some
there
more.
are 2 veins and 1 artery in the middle, right? Yeah, there's veins and arteries.
So,
And there's a vein that carries oxygenated blood.
yeah, but I don't teach that to EMT. So,
Just to confuse everybody.
What about pediatrology?
breech delivery. We're going to talk about some abnormal deliveries. Okay, the most common is breech delivery.
No, we-
This is where, remember I told you normally the head
Comes first.
comes out first. This is the opposite. Okay, the opposite is coming out first. You can actually deliver this. It's not easy. You want to try to get moving to the hospital. Let the doctor deliver it. It's very difficult, especially, you know, the leg's gonna be up, the buttock's gonna come out.
But yet, you
Well,
see the
if
leg
she-
coming out, you don't necessarily have.
I didn't get to that one
Yeah,
yet.
first a different one. They claim
This
some
is
sort of
breech
correlation to
delivery.
high IQ with breech babies.
They what?
No.
They claim some sort of correlation to high IQ with
I
breech
guess
babies.
you were British, yeah.
But you said you wanted to try to get to the hospital, you
My
wouldn't
brother
know
was
at
I
that.
was all types
How
of
would you
stuff.
know?
No, if you see
See the-
tuchus,
Right, by the time it's
Instead of head.
out, there's no
With the
time to get
knot
over
in
to
the
the
cord.
hospital.
okay, so then you'll,
Doctor's
I was like, I
turn
wanna
the
kill
baby
myself
over.
before I even get out
You're
of
on
here.
the, you're on the bus, and the baby
On the
starts
victim's arm,
a
yeah,
regular
next to
birth.
the
You should
no
stop
slack,
the
you can
ambulance
get
or
it
keep
out.
going?
it's easier to deliver when you stop, yes.
That's his mom.
Okay? Alright, limb presentation. Here we have hand, here we have leg. True emergency, very little we can do for it in the field. So drive faster. Get to a hospital. Prolapse cord, this is the one I want to talk about a little bit. So the prolapse cord is now hanging out through the birth canal, through the vagina, and this is an emergency for the baby. The baby may not make it if you don't do something.
There's compression on the cord.
What you see here is that between the uterine wall, baby's head, and here's its cord. Remember, until the baby comes out and takes its first breath, everything is going through the cord. Now the baby is putting pressure on its own cord.
Is that what happened by your building? Oh, you said you saved.
No, that was nuchal cord around the neck. So, we've had these cases also. This is the case. This is one of the only times you need to insert your hand up into the birth canal, through the cervix, get the baby's head, and move it away from the umbilical cord. You need to stay like that all the way till the emergency room, and you may need to stay like that through till the operating room, till the surgeon shakes your hand from the inside, okay? Yeah, that's what they like to do.
Yes.
That happens to you?
Yes,
For real?
okay? So you need to push the
I hope it was
babies,
a smaller watch.
waterproof.
That's, you know, a couple extra inches getting that one in there.
Yeah, don't
Comes
use your
up.
watch hand.
Don't use your watch,
Poor the mother.
okay?
She'll have imprints on your dial.
Citizen.
It comes out. Yeah.
Alright, so true emergency needs to be dealt with. This is
You have
one
to
of
be
the only
careful of
times.
The fontanelle on this one. If you're putting your hand in there on the
No,
baby's head,
you're going to sort of put your hand here, and just carefully move it away. You're not going like that.
How do you know what a way is? You can manage to see which side of the.
Yeah, you'll feel around.
You kidding me? You walked into the
But why do you need to keep the hand here?
Because otherwise the head's gonna go back and occlude the cord. Okay? Here, excessive bleeding, we mentioned this before, right? In excess of 500 cc. Massage the mother's uterus, slows down the bleeding, or get someone else to do it for you. Treat for shock if you see more than 500 cc, more than half a liter, you may need to treat it for shock. And pad in your kit you can place over the vaginal
should you
opening.
be checking blood pressure? How often should you be checking blood pressure?
Just like any medical patient. If she's stable, every 15.
When my wife was giving birth, they had the blood pressure around her arm the entire time.
Yeah, they just leave it
They
there,
do, the
right?
machine
Oh,
only
the
goes up
hospital,
once every
right.
15 minutes.
No, they keep pushing the button.
But
every
in the
so often.
ambulance.
It's automatic, the
That's
machine.
what I'm
The
asking.
machine's
We don't
automatic.
care about the hospital. We're not.
How would you know about that other
The
thing?
machine's automatic, goes every 15 minutes.
You see it.
They told her, she was on the phone
No,
afterwards,
it's not hanging out.
and they weren't getting your reading on the blood pressure. They said you have to put your, every every 15 minutes, just put your hand down
Yeah.
for a second.
Okay,
Is there a way to know besides seeing the
can I finish? Nonetheless, we'll get to the questions. Let me finish. Abortion. Abortion is the word we use for both a woman going and having some doctor put a coat hanger up there and pulling it out.
Nazi!
And we also use the same word for a miscarriage. It's called a spontaneous abortion. Now, women don't like the word, so that's why they came up with miscarriage. But for us, they're all abortions. Some done with a coat hanger, and in a back alley
It's a
and
spontaneous pneumo abortion.
some done, you know. So we're worried about always miscarriage, about infection.
Thank you for
Treat
that.
the mom, she could lose a lot of blood.
Thank you for the pictures.
Bring,
That's what we want.
bring whatever you can, whatever pass through, whatever tissue, whatever pictures he's showing you on the group,
don't wanna see it.
bring all that to the hospital. I saw them. Twins.
You ever
There's
deliver-
always a test question on twins.
you ever deliver twins?
What?
Ever deliver twins?
No. The first one, not the
They say
second.
you're not a real true medic until you do it. The good ones deliver quick.
Hand delivered to
That was our chance.
There is always a test question on twins, and they ask you this question: how many placentas do twins have?
one.
No,
Depends what kind of twin. Machlekes.
not one. So
Yes,
what's the
yes.
answer?
Yes.
Two? No.
Depends on the.
The 1.5.
No.
No.
Could be one or two.
One for each.
Okay?
Could be one.
So here you
One
have
for each egg.
Here you have one placenta. This is when the twins are identical twins. One egg, one sperm, one placenta. Here you have two eggs, two sperm. And here you have how many?
2%.
Two placentas.
Do the babies grow differently in utero depending on the amount of?
No, they just asked this question. Makes no difference to anybody's life.
Because sometimes
Well,
you
I
have
mean,
like
if you're-
one is bigger than the other.
If there was a third baby that didn't make it, but like in the 5th or 6th month, would the placenta have already come out for that baby?
If it has its own.
Yeah, what's with your pictures, man?
Okay? So one or two, just depending. That's it. Infant and addicted mother. We need to, crack baby, we need to expect respiratory depression. If there is respiratory depression, what should we be ready to do?
Ventilate.
Ventilate, right? That's it. Preemie,
That's a little baby.
okay, yeah, it's very little, preemie. Remember with preemies, the key thing again, keep them away from infection or anything dirty. Keep them warm, even more carefully than a regular baby, okay? Keep them clear of mucus, give them blow by oxygen. Don't let them get infected. Notify the baby that you're coming in. Again, you want to know how many weeks.
Notify the hospital.
What?
Notify the hospital, not the baby.
Yes, notify the hospital. You want to know how many weeks this baby is. Okay?
Consent.
There's also a difference in what is considered a preemie. We usually use 36 weeks. Prior to 36 weeks, we'll say it's a preemie. Between 36 and 40, we'll say
Full term.
term. Stillbirth, stillborns, these are very sad situations. The mom actually has the baby, okay? And you can just see. You see the blistering, you see the skin falling off, all sorts of problems that you're gonna see.
Question on stillbirth. How do they go through the birth if the baby's not alive? But there's nothing to do with the baby itself.
Self-deliberate.
The baby doesn't do
baby climbs
anything
out?
during the,
No.
Question is, what do you do with the baby?
You take it to the hospital with the mom,
I'm not coming out.
okay?
Is that what's out there?
You don't
All right, this is a very important thing I want to explain to you. All right, this is about meconium. If the baby gets stressed during the pregnancy, okay? If the baby gets stressed during pregnancy, why does baby get stressed during pregnancy? Because
Labor or pregnancy?
not coming out.
mom was stressed during pregnancy.
Oh, they're
Not just during labor, anytime. And basically what can happen is that the water, which the ladies call my water broke, right? It's really amniotic fluid. But if the baby got stressed during labor or pregnancy or whatever, late on, fetal distress, the baby can actually have a bowel movement inside the amniotic sac in utero. When that happens, it turns the nice water, clear amniotic fluid into what I can only describe as pea soup. Okay? Sometimes it's green, sometimes it's yellow. There are many different colors that I've seen. But this is just for you to remember the meconium happens. And the problem is with meconium that while the baby's in utero and amniotic fluid is going into the mouth and down into the lungs, it doesn't matter. It's sterile. It's okay. Problem is when it's got poop in it, right? This is a problem. So now we need to remember this. We need to look at the sheet where she tells you her water broke. We need to ask her, what color was the water when it broke? If you're not there to see it, or, okay? So it does sometimes cause pneumonia.
They put the baby on antibiotics after this one.
Yes. So again, it's something that you want to alert the hospital to. Nothing particularly that you're going to do. Just make sure you really suction well. Make sure you get out whatever you can from the nose and mouth so that the least possible is aspirated. And this is the deal. This is meconium.
Take a break.
Fruit because he's gay?